I was trapped in my vehicle. A police officer got me out. Ambulance came. All they did was come up to me and ask me, "Are you okay?" And I did not want to be transferred because I didn't want to be billed.
A woman told the Waynesboro City Council she was frustrated with the way first responders manage their services.
I don't want that bill. People do not, if you're in a motor vehicle accident or if a family member is just too sick and you don't know. I also did emergency service as a trauma tech for 10 years. I would rather go out to the house and make sure and give that family a peace of mind. Your mom's okay, your dad's okay. They don't need to go to the hospital. I'm not out there to charge them.
Charlotte Badenhop told the City Council people who turn down emergency medical services technicians' assistance should not be required to pay a bill.
To be charged for something, it's a public service. I volunteered my services. I don't want to do it. I quit because of this. I quit because I'm not going to have my people that I go and help be billed just for peace of mind. I just think it's ridiculous.
Badenhop says she has worked as a 911 dispatch operator for more than 3 years. She has also worked as a trauma tech for more than a decade. I caught up with Badenhop at her home. She explained to me her opposition of people allegedly being billed for fraudulent medical services.
So when I heard that Waynesboro was going to charge for this, I spoke because I just feel that you don't charge for services not rendered. I've seen people post up, well, people just abuse the ambulance services. They do, but if you're transporting them, charge them. If you're not transporting them, why charge them? You're just going out to do checks. I get that. I just don't see how you can charge somebody for not doing anything. Checking vitals, it's simple. It's a basic life support, EMT, first aid. Responders know how to check vitals. It's easy. You didn't use any equipment.
Now Badenhop will be the first to admit she does not know firsthand the cost for ambulance services in Waynesboro, but she says she has spoken with people who have been charged.
I personally was just in a motor vehicle accident. I refused to go. I should have been gone in an ambulance. I did lose consciousness, but I could not afford that bill. I'm hearing, so I don't know for experience. I've never gotten charged. I'm hearing it's a good $800 to $900. And then the emergency room is a good $800 to $900. I went to the emergency room. I have great insurance. I still have a $487 bill. So, and I was there less than an hour.
She added cities and counties that have available funds should use that money for emergency services.
Hearing in the news of towns and cities having surpluses, it's kind of irritating when you can put that towards the ambulances, the rescue squads, the police departments, the equipment for them. Don't surplus it. It's ridiculous what I'm hearing for surplus. So I think the cost of the ambulance rides could go down if the towns and the council members think about the things that they may not need. They may not use a rescue squad. They may not use a fire department, but they better hope that their house doesn't catch on fire or their loved one doesn't get sick and then they get stuck with that bill.
According to authorities, the Waynesboro First Aid crew has never charged for services that were not provided. I went to the director of the City of Waynesboro Department of Emergency Management and EMS, Gary Kreitzer. He says, yes, the 2005 ordinance regarding the way they bill for service fee for ambulance transports was recently amended. He explained it was necessary to make the change in the ordinance because of changes in the EMS billing practices nationwide.
Previously, our ordinance only allowed us to bill health insurance for the transport of patients to the hospital. The change in the ordinance allows us to bill alternative insurances in the event that someone doesn't have health care insurance.
He says, for example, if someone was hurt in an auto accident and does not have health care insurance but does have auto insurance, which includes medical coverage, they could then bill the alternative insurance to pay for the transport.
The other addition that it allows for the billing of what we call treat and release, that would be an incident where if EMS was called to a location, and the example that I often use is a diabetic patient. Now, we get called for a diabetic patient. The patient needs medication, they need to be treated at the scene, and they're treated, and then the patient responds favorably. wakes up and says, I took too much insulin, or I forgot to eat this morning, and I'm okay. I don't want to go to the hospital. I'll call my family doctor. And they sign what we call a medical release or a patient refusal from transport. We will be able to bill for that service because there are medications used, there's treatment provided, the vehicle's tied up, and we'll be able to bill for that service. What it won't allow us to do, and I think there was some confusion in the community, was that it will not allow us to bill for what you would just consider a traditional refusal. An example of that would be that there is a motor vehicle accident, and often in a motor vehicle accident we receive multiple 911 calls. Today, with people having cell phones, you'll often get 8 or 10 911 calls for one motor vehicle accident. EMS and fire show up if there's a report of injury or there's unknown injury. We send EMS and fire along with law enforcement. They get there and they come up to you and they say, "Are you injured? Are you okay?" And you say, "Yes, I'm fine. I don't have any injuries. I don't need any help. Thank you very much." They will not bill you for that service. That's not something that you didn't request it. You don't need any care. You don't need any treatment. At that point, you're not even a patient. You're just someone who was in an accident that's uninjured. You would not receive a bill for that service.
Badenhop says she gets upset when she sees what appears to be EMTs goofing off.
And on Saturday mornings, I'm seeing the rescue squads going up and down Hopewell Drive and up and down West Main Street, just riding around as I'm doing my grocery shopping. It's not just I just go to one store. I go to several stores, get my shopping done early. But there's the rescue squad just riding up and down the roads. It's kind of irritating. I get that, yes, you may want to go to breakfast. But for our rescue squads, we made plans to have breakfast at the squads. You have a kitchen unit, use it. That's what the money has been put in the squads for. Use it.
They have to eat just like everyone else does, and it's not always practical to cook at the station. Sometimes they do that, and oftentimes it gets left or it doesn't get finished. It often works better to try to grab a quick bite at a restaurant, and oftentimes if you have to leave, the restaurants are really good about holding on to it, or I've even had restaurants prepare a new meal when you came back. There's often times that they either have errands to run to pick up supplies or exchange. They might have to run to the hospital and exchange a drug box or things like that, and they do oftentimes, as is pretty norm in the industry, they will stop and have lunch or have breakfast if they're out on the road. In the line of work that they do and the call volume that they have, it's often difficult to try and prepare a meal at the station because you'll get halfway through it, a call will come in, you leave it, and you never get to eat. So I've been in this business a total of 42 years as a volunteer and a career provider, and sometimes you got to grab it when you can grab it. If you're working a 12 or a 24-hour shift, it does often mean that you're going to stop somewhere and grab some lunch or some dinner, and many times that gets interrupted and you never get to finish it.
She admitted it's possible there could be a misunderstanding between her and the city council.
I felt like I was alone. I felt like maybe people just didn't understand what was going on. Maybe people didn't know, but maybe my voice will count. Maybe the council just doesn't understand what's going on out there. So I felt I just needed to go and say what I needed to do. Honestly, I walked in from home, I turned the news on, I heard what was going on, I left my house immediately. And I went straight down there. I was like, got my notes together and just said, I'm going to speak. I'm going to say what I need to say, and people need to be aware of what's going on in here. So I don't think they understood. You just can't charge. Don't charge grandma when she can't afford it.
In Waynesboro, Elaine Rackley for Breaking Through News.